Hi, my name is Holly. So I don't know how many of you have weird habits as me. When I bought a new shampoo or toothpaste, I would like to read the ingredients on the container, even though I have no idea about those chemicals. But do you ever think about your shampoo on your pets? So let's imagine when you are taking shower tonight. Will you enjoy the smell and the rich bubbles? Do you realize how many animals are routinely dying in the testing of the shampoo and the soap? Okay, let's start my topic. Should animals being used for scientific or commercial testing? My main claim is animal testing should be banned. Animal experience want us to believe that if they give up our unhealthy habit, sick children and other disease can accidentally victim would drop dead in drops. But the most significantly change in modern research in recent years has been the recognition that animals rarely serve as good models for the human body. So the first supporting claim is animal test is limited. As we all know, we use a lot of math in animal testing. However, the body effects different in mice and humans. To compare mice and humans, mice has stronger immunity. So even if the drug is safely used in mice, it still can be dangerous to human. Some people also say chimpanzees share the 99% similarity to human DNA. However, chimpanzee population is really small. It's nearly impossible to use for the animal testing. Another example is arsenic. It is a chemical substance. It is harmless for the frog and sheep, but it's very poisonous to human. Drugs that pass animal tests are not necessarily safe. So there are 92% drugs that pass animal testing but fail in human clinical trials. According to the neurologist Asha Akata, over there are 100 stroke drugs that were effective when testing on the animals, but which is fail in humans. And over 85 HIV vaccine fail in humans after working well in non-human patients. My second supporting claim is alternative testing method now exist, which can replace the need for the animals. So animal testing may misleading the research into ignore potential cure and treatment. Former U.S. National Institute of Health Director Dr. Elisa Zaharanis admitted that experience on animals to help humans has been a major failure. The problem is that animal has the work, but it's time we stop dancing around the problems. We need to refocus and adapt with the new methodologies for use in humans to understand the disease in biology way. And many of the advancements that give us a high standard of medical care we enjoy today and have come from scientific methodologies that do not rely on use on the animals. There are some significant medication progress can be attributed to scientific methodologies such as clinical observation, in vitro research using human cells, epidemiology, and genetics. Alternative scientific tests are often more reliable on the animal tests. For example, experience on rats, pigs, mice, monkey, and bamboos revealed no link between glass fiber and cancer. Only after human studies related with healthy administration label this fiber as carcinogenic, and also there are other research, epidemics, which is an in vitro test that derived from the cultured human skin cell, was found to be more accurate used in identifying chemical skin erectors. And also my third supporting claim is non-animal tests are more cost-effective, particular and expedient These modern methods include sophisticated tests using on human cells and tissues are effective. In virtual testing, it can provide a chemical corrective determination in a little at around 3 minutes to 4 after 4 hours we will know the result. But it's not likely animal testing that often takes 2 weeks or 4 weeks. Another example, duck is an alternative test used to measure the effectiveness of sunscreen. Was reported to doing what is taking animal study method to do, and the estimate that can test 5 or 6 products for one time in the virtual testing, but sometimes the animal testing take more than 2 years, 4 years to get one result. Animal testing are more expensive than alternative method, and they are wasting of the government money. So here there are some examples. There is a research which is called Two-Space Lifetime Cancer Study. It will cost $2 million to $4 million. And the U.S. National Institutes of Health spent $14 billion to 31 billion annual budget on the animal research. So to summarize my claim, I think animal testing is cruel and inhuman. It should be banned because animal testing has limits. Like I said, even it's testing safe on animals, but it's still not safe for the humans. And second, it is still not the alternative test can be safety and successfully to replace other testing, like animal testing. So it's not necessary to use animal testing. The third, the non-animal tests are it will cost more money. So we could use some alternative tests instead of the animal testing. Thank you.
All right, well, the opening sets up the topic adequately. I think the problem with the proposition is first it's stated as a question and then it's stated as a policy claim. So you've got problems right away with the purpose of the particular assignment. The secondary claims need to be labeled a little bit more clearly. It seems to me like you are kind of rushed through them in the preview, and that needs to be, you need to be a little bit more patient in presenting those. Excuse me. The secondary points, the second and the third point, I did think were labeled pretty clearly. It seemed like you also were starting off where we expect you to start on that first point. It sounds familiar since we already heard similar arguments on the same point. I didn't hear any source citation on the data on animals. I'm sure that there is some. We did get one example of testimony from a former NIH director. The statistic that you had on the failure of drugs that don't make it through human trials needs a source citation also. What's interesting is that that seems to suggest that there are some drugs that do succeed, even though they don't succeed at a high rate. The question would be, would we have been able to discover the drugs that did succeed without the animal test? And that's where I think your evidence needs to apply a little bit more effectively. As it is, we get kind of generic information about the alternatives, in vitro tests, DNA tests, and none of that seems to be applied to the particulars that you are citing in the second point, so I'm not exactly sure why they should be all that convincing. Let's see. The cost issue that you present really seems to be kind of counterintuitive. If in fact the alternatives are cheaper and more efficient, then why the hell aren't people doing them? Because I can't imagine that a drug company wouldn't want to get the same outcome at half the cost. Yeah, that would increase their profit margin substantially, and there's no explanation about why such conundrum exists. It just seems to be assumed that everybody here is ignoring the obvious, when I think there's a lot more controversy on this subject than we're being led to believe. So I think part of the problem is the citation of sources here. You need to be more consistent on that. The structure was okay. I thought it was relatively easy to follow. Sometimes the examples, I don't think they go as far as you need them to go. And like I said, sometimes they're not really cited as clearly as they need to be. When you get toward the end of the speech, you also divert off onto a value issue about it being cruel and inhuman, and that's not relevant to the question about whether or not it works. So, you've got a supporting piece of information there or argument that you're presenting a justification that doesn't address the factual issue. I thought that you had a relatively good summary. Of course, most of it occurred in overtime because you did go a little bit overtime. All right, thank you.